Good evening. Big spending, big deficit. The NDP government has delivered an historic pandemic budget.
It's their first economic blueprint since February 2020, before COVID-19 upended the world.
$3.25 billion is earmarked for pandemic recovery and contingencies, including $900 million for vaccine distribution and COVID testing. BC is forecasting a deficit of $8.1 billion this year and $9.7 billion next year.
Along with an increased disability benefit, there is also free transit for kids 12 and under, and the promise of thousands more childcare spots at $10 a day.
Good evening. Now to the details of BC's fiscal roadmap as our province struggles to overcome COVID-19's crushing third wave.
The government claims these measures will help families and businesses weather the storm and recover on the other side of it. But critics say the budget is missing the mark on several key fronts. Binder Sudjan begins our coverage.
Armed with the NDP government's first majority budget, Finance Minister Selina Robinson delivering her speech in the middle of COVID-19's third and worst wave.
A little over a year ago, our government tabled its last budget. And within weeks, our world was turned upside down.
Previously balanced books now bleeding red, with deficits projected for several years. For the year just ended, from a projected $13 billion to an $8 billion hole. This year, it's $9.7 billion. As many businesses and people struggle, the government setting aside billions in case the pandemic brings more pain.
We've been moving as quickly as we can to get money into the hands and into the pockets of British Columbians and into the economy.
And the government has acted quickly in many ways to support particularly small and medium businesses, but this budget doesn't include a lot around new funding for economic recovery.
Roughly half of the money set aside last year for small and medium-sized businesses is out the door. Women, the young, and people of color have been hardest hit.
Given the deeply unequal impacts of the pandemic, I think this budget misses the mark on addressing some of these inequities.
The budget awash in NDP colors, with billions more over the next 3 years to expand services, including healthcare.
Budget 2021 delivers $4 billion over the next 3 years to help keep people safe from COVID-19 today, while strengthening our health and mental health care system for tomorrow.
There's also more money for schools and to increase income and disability rates. The province also boasting about the largest infrastructure spending in history.
Our capital plan is about roads and bridges and hospitals.
While we see a lower projected deficit, the debt, the actual total debt, is skyrocketing at an alarming pace, and they need to get that under control. They're actually projecting that it's going to be going up 45%.
While projects increase long-term debt, higher revenue, including taxes from a boom real estate year, are helping soften the blow.
The speculation tax delivered 18,000 homes to British Columbians because of that tax. It's very significant. We're making the biggest investment in subsidized housing and in affordable housing in this province's history, with 26,000 units already underway or in development, or in fact people living in them.
They've promised 114,000 affordable housing units, barely even a mention in this budget.
Just over 7,000 units are complete, with another 4,500 expected to be move-in ready by next year.
Binder joins us now, and Binder, this pandemic has really exposed major problems in the long-term care sector. What's the government doing to improve life for seniors?
Yeah, Scott, and advocates say they like what the government's doing in terms of planning to level up wages for some of these healthcare support workers. They're also spending $600 million over several years to train 3,000 people to get into the industry. Now, where they do have questions is on the bed side. Now, many public facilities will get upgrades, a few thousand units, and BC Care Provider says that's just not enough to meet the expected demand.
The Health Career Access Program money is very welcome, and that'll make a big difference in recruiting and retaining employees. In terms of capital investment, it's good to see the older health authority beds being replaced, but adding only 1,500 new beds will be short of what we need.
And Binder, from seniors to children, when the NDP were first elected in 2017, they campaigned on $10 a day childcare. Can you give us a reality check on that, and what is this budget promising?
Yeah, so Selena Robinson today announcing that the government would double the number of up to $10 a day childcare spots. So that sounds impressive. But when you break down the numbers, there are currently around 3,000 spots. So if you double that and add a few thousand more, well, that's just a drop in the bucket if you look at the tens of thousands of parents who have kids in daycare. Now, some advocates are worried, saying that this project or this program may be stalled because perhaps the province is waiting for the federal government to step up with more money and to allocate that. But of course, part of the equation here is the pandemic. We are expecting deficits for the next 7 to 9 years. Scott, Ejun?
Okay, thank you, Binder.